New York City's Board of Health voting unanimously to add salt warnings to menus. The groundbreaking rule mandates that chain restaurants add a salt shaker warning symbol to menu items that are high in sodium. Restaurants are calling the proposal a misguided step that could lead to an onslaught of confusing warnings. Joining me right now is the CEO of the Mayo Clinic, Dr. John Noseworthy. John, good to see you again. So nice to have you back on the program. Welcome. What's your observation on this salt ban?
I think it's a great move, to be candid. I think it's important for our citizens to know that what they're eating and is it healthy or not. And most of us eat too much salt. Americans eat too much salt.
Salt and sugar are the enemies.
And this is about salt, and 2/3 of the salt we eat is in processed food. So most Americans would say, I don't use a salt shaker, but they're still eating more salt than they should. It's related to hypertension and heart disease and stroke. And it's also important for moms to educate their kids. We have to have a change in our behavior, which is what you're alluding to with sugar and salt, and this is a good way to start.
So how bad is salt for us?
It's significant. There's a very clear relationship between salt intake and blood pressure is the key link to heart disease and to kidney disease. So it's a big deal.
Right. And heart disease is the number one killer.
Indeed. So this is a big deal. This is a relatively easy move. I don't think it'll be confusing, candidly. You look at a salt shaker and say, do I actually need to eat that processed food? It's mostly the processed food.
Are we incapable as individuals and as a society of making these smart decisions on our own? Do we need the government? People get upset when the government adds like when restaurants are forced to add calorie counts on their menus. The large soda ban here in New York City, people were outraged over the move to do that. Is it going to be more and more government intervention because we can't manage our own health?
Yeah, Dagen, I can't really comment on government regulation and how that works, but it is hard to change human behavior. The key here, I think, is that a lot of kids go to chain restaurants with their moms. This is a great chance for them to say, see, this is related to what we've talked about at home. It's very quick. So I think we're going to have to change a whole generation of food habits in this country. I don't know how that's done, but it's very difficult to do.
I want to get your take on what else you've been working on at the Mayo Clinic. And you recently did, you had a collaboration with a company called Helix, also Illumina. Talk to us about what you're doing in terms of getting ahead of disease at Mayo.
Sure. So we've made significant investments in our research in individualized medicine and genomic medicine to help patients understand how does the gene affect our predisposition to disease and how does it impact how we respond to treatment. So we've announced a collaborative relationship, strategic collaborative relationship with Illumina, the gene sequencing giant from San Diego, with investors to create a company called Helix. And this basically accelerates bringing genomics to the consumer.
Wow,
and so
big deal.
This is a big deal, and we're very excited about it. Mayo's role in this is educational initially. What do you need to know about the genome? What can you know? How does it affect your health going forward?
So why is this a big deal? Number one, we are getting ahead of disease ever since we started mapping the genome.
Correct.
Craig Venter, among those people, Dr. Craig Venter, who mapped the genome 15 years ago, he told me recently, in the next 10 years, we're going to be living into our second century because we're getting ahead of disease. How are we doing that? Through sensors? How are we getting ahead of disease?
I think all of this, consumers, patients, people need to know what are they likely to get sick from and how do they get ahead of it. It's much easier to prevent a disease and treat it early than to wait until we're mapping it up later.
Like the BRCA test for women who are predisposed
That's a great
to breast
example.
cancer.
Yeah, inherited cancers, and it also impacts how we respond to medication. The four of us likely respond differently to Coumadin, antidepressants, painkillers, and so on. And some of us need a higher dose, others need a lower dose, depending on our genes.
So do you think we're at a break-even or sort of a breakthrough spot in terms of the brain? Knowing more about Alzheimer's, learning more about autism?
I think we're getting there.
Because of the gene mapping? Well,
because of a lot of discovery science that's underway, but we need to continue to fund excellence. That's absolutely key to America to be a leader in this area.
I love this collaboration with Illumina, and the company is called Helix. Congrats. Good to see you, Doctor.
Thanks so much.
Thank you so much, Dr. John Noseworthy. Up next.